we are going to see the synovial membrane of the knee joint. So this diagram shows the anteriorly opened knee joint. The patella is reflected downwards. You can very well see the synovial membrane if you trace along this red colored line, right? Now you are able to understand, you will be able to appreciate a fold of synovial membrane here that is extending from the lower aspect of the patella towards the intercondylar area of the femur, intercondylar notch of the femur. And here in the upper part you can see the synovial membrane extends upwards adjacent to the lower end of the femur. Let's see how these folds are arranged with the help of a sagittal section. This is the sagittal section of the knee joint. So here is the patella, here is the lower end of femur. This region will be the intercondylar notch, posterior part of the intercondylar notch. The lower condyles are not visible since it is a sagittal section. This is the upper end of tibia. Now, if this you can very well see the synovial pouch of the knee joint over this region. If you trace the synovial membrane above from the upper margin of patella from here, it is continuous with the suprapatellar bursa. This is the suprapatellar bursa. So the knee joint, synovial membrane of the knee joint is continuous with the suprapatellar bursa, and that bursa is a synovial pouch intervening between the quadriceps femoris muscle and the anterior surface of lower part of the shaft of femur. This apex of the bursa will be kept in position by the articularis genu muscle. We have already appreciated the infrapatellar fold in the previous diagram. So it's a triangular fold of synovial membrane. It extends, this is the infrapatellar fold. You can see here, this is the infrapatellar fold. It extends upward and backward and intervenes between the femoropatellar and both condylar parts of the knee joint. That means it starts from here. Here it intervenes between the femoropatellar region. Here it intervenes between the condylar parts of both the femur and the tibia. This is the apex of the fold. This apex of the fold is attached to the lower margin of the intercondylar notch of the femur. This is the intercondylar notch and the apex is attached over here. Its base, this is the base of the infrapatellar fold. This base is directed towards the ligamentum patellae. This is the ligamentum patellae, and the base of the infrapatellar fold extends from the apex of the patella. This is the apex of the patella to the anterior part of the intercondylar area of the tibia. This is the anterior part of intercondylar area of the tibia. Some fiber of fatty tissue enters the fold through the base. Let's trace the infrapatellar fold in a somewhat transverse sections. So this is the condyles of the femur and this is the inferior view. So here you can see the apex of the infrapatellar fold. Simultaneously, this will be the superior view of the tibial condyles and menisci. Here when you trace along this red line, you can see the infrapatellar fold. On two sides or this region you will have the alar fold, and the semilunar intervals between the alar folds and the condyles of the femur communicate with the femoropatellar compartment. Then we also have to appreciate some other interesting features, that is, this is the posterior part of the fibrous capsule or knee joint. From the posterior part, let's trace the red lines, that is the lining of the synovial membrane. From the posterior part, the synovial membrane projects forwards in the intercondylar region as a cul-de-sac to envelop the sides of both the cruciate ligaments. This is the posterior cruciate ligament. This is the anterior cruciate ligament. You can very well appreciate the synovial lining and how they are arranged. So simply put, the synovial membrane lines the side and front of the anterior cruciate ligament, side of the both cruciate ligaments and front of the anterior cruciate ligament. Now, because of this particular arrangement, here one cavity-like structure will be there, here the infrapatellar fold will be there. So this region, this central region will form a communication between the lateral and medial intercondylar joints. So this region is known as the intercondylar foramen. As you can see, this foramen is bounded in front by the posterior surface of the infrapatellar fold and behind by the synovial membrane covering the anterior cruciate ligament. That's all about the synovial membrane of the knee joint.